If you really want to make an impact, it's starting with children when they start school and planting that seed then that you can be a doctor. And so we've done things like having medical Mondays at middle schools where we actually have placed a dental chair in a middle school and give them the opportunity to actually come in and letting them look in our mouth and pretend to be a dentist, putting on white coats and letting them take pictures so they see themselves and they begin to imagine. That's what they do with basketball. They put a basketball uniform on them and they put a basketball in their hand. Why can't we do the same thing in medicine and dentistry?
That's the voice of Dr. Cherae Farmer-Dixon, Dean of the School of Dentistry at Meharry Medical College. Dean Farmer-Dixon remains one of only a few select women to lead in the role as Dean of Meharry's Superior Dental Program that produces 40% of the nation's currently practicing African-American dentists. My name is Dr. James Hildreth, and you're listening to Public Service Announcement, a brand new podcast dedicated to making complicated healthcare topics easily digestible for all who listen. This season, we will focus on an array of topics like public health, health equity, data sciences, disease states, medical modernization, and more. In this episode, Dean Farmer-Dixon joins me for an insightful conversation on the importance of oral health to one's overall well-being and how a single visit to the dentist could potentially save your life by helping detect other related medical issues. We also discuss the challenges associated with the lack of diversity in the healthcare workforce and why it's so crucial to address them head-on now more than ever. To learn more about this show or to learn more about Meharry Medical College, visit www.mmc.edu. Today's public service announcement is that the mouth is connected to the rest of the body. And because it's connected to the rest of the body, the health of the mouth can impact the health of the whole body. So, Dean Farmer-Dixon, let's start at the beginning. Why is the health of the mouth important to the health of the whole body?
In the mouth, you automatically have bacteria, but there's some that we call kind of a healthy bacteria. You want to have saliva in your mouth that helps to move food around. But there's also bacteria that can be bad bacteria, and that's the bacteria that can cause cavities. That's the bacteria that can cause gum disease, that can eventually lead to tooth loss. And so some of the foods that you eat can increase that bad bacteria. So if you're eating more sugar, sweetened beverages, or foods that have high content of sugar, then that can cause you to have more bad bacteria that can lead to cavities in your teeth. Those cavities, if they go untreated, end up breaking down, and you end up eventually, unfortunately, if they never are treated, having those teeth extracted. That's why it's important to know what you're putting in your mouth and what impact it's having on, first, your teeth and your gums, and then secondly, how it impacts the rest of your body.
Dr. Farmer-Dixon, according to the CDC, among working-age adults in the United States, more than 40% of low-income and non-Hispanic Black adults have untreated tooth decay. Why do you think there's this kind of disparity in oral health and between racial and socioeconomic groups?
Unfortunately, there's several things that attribute to that. One of those being access to care. When we talk about access to care, for working adults, many of them may have insurance, but that insurance does not include dental coverage. And so as a result of that, they don't have the resources to be able to afford that care, number one. The other thing is that let's talk about maybe low-income families where children maybe have care, but they don't have access, meaning that they may not have healthcare providers in their area that will take, if they're on Medicaid or on TennCare type services, that will be able to accept the insurance that they do have. And so we really find that, especially with adults, that a lot of them don't have insurance. They're on fixed income, and so they're not able to afford. And when you're on a fixed income and you're trying to identify what are my priorities, taking care of the household, those things become the priority. Making certain you've got a roof over your head, making sure that you've got some of the medicines that you need, making certain that you have food on the table. Those things take priority over your dental needs, and it does not become a necessity until, unfortunately, it gets to the point of being a toothache or tooth decay.
That's very interesting, and it reminds me of the social determinants of health that we talk about for overall health, where your income, where you live, your environment, all those things impact your health, and it sounds like the same thing is true for oral health.
Absolutely.
Now, the CDC has some very interesting statistics that we might share. Over 34 million school hours are lost in the United States in 2008 because of unplanned urgent dental care. Over $45 billion is lost in productivity in our country each year because of untreated oral disease. And nearly 18% of all working-age adults and 29% of those in lower incomes report that the appearance of their mouth and their teeth affects their ability to interview for a job. So what are your thoughts about this, and can oral health improve the job prospects and the economic status of low-income Americans?
I think that it can, because when you think about it, appearance does matter in some positions. And so it limits your ability to be selective in the types of jobs. You may have the skill set, but from an appearance standpoint, if you're totally edentulous or all of your anterior teeth are missing, then that does impact your marketability. If you have the skill set and someone next to you also has that same skill set, but from an appearance standpoint, they are looking a lot better, then unfortunately you are putting yourself at a disadvantage.
Dentists can actually be the first to detect a serious medical problem. Can you speak a bit more about that?
Some of those, a lot of times, if you're not going to dentists on a regular basis, you get gum disease. And if you have infection that's going on in your mouth that is associated with certain bacteria, those bacteria can travel through your bloodstream and they can impact your heart and cardiovascular disease. And so the most common things that we see are periodontal disease being associated with diabetes, being associated with cardiovascular disease, more recently with Alzheimer's disease. But we're also seeing that with smokers, oral cancer. A lot of times, patients that have HIV and AIDS, some of the early indications are seen in the mouth with oral cancers or with lesions that are going on in the mouth. We'll see a patient and we'll see that they've got puffy gums or bleeding gums, and they've not been to a physician, their medical doctor, on a regular basis. But there are indications that they may have hypertension or that they may have diabetes, and we refer them to a physician, and then it's confirmed that they do have those. So that also leads into the importance of having integrated care where there is a connection between the team approach to healthcare with the physicians working with the dentist and vice versa.
And that reflects an earlier point you made that oftentimes the insurance that people have for their health does not cover dentistry. So we need to come to a point in our country where oral health and systemic health, they're covered by the insurance you pay for, so that you can go see the dentist as often as you go see your primary care doctor.
Yeah, so that it's seen as a necessity and not just as a cosmetic option.
Exactly.
And so by most companies, when they are offering healthcare coverage, that coverage is medical care. And so it's a misnomer when they say we offer the option of affordable health care for you. And so most people, unfortunately, decide not to add that on because that's going to be additional cost. In addition to, for those that do, it may cover examinations at 100% or cleanings at 100%. But if you've not been to the dentist, then having a routine cleaning is likely not what you're going to need. And so then you're going to have an out-of-pocket cost. And if you've got cavities, there's going to be an out-of-pocket cost. And so the average person, when they're looking at that, then the question, well, what am I paying for? And why should I? And they don't see the significance or the importance of that. In addition to that, I think that, and I'll use Medicaid again, Tennessee recently expanded their Medicaid or TennCare, it's called, coverage to include adult dental coverage. And so that is kind of on a state-by-state basis, but it is a step in the right direction of being intentional about making certain that not only are our children covered, but that those adults who are on TennCare or are eligible for it can now receive and seek dental care as well. The other thing is that in those instances, making the remuneration rate as attractive as possible, because if you can't find a provider, that takes it, then you've not really moved the needle. And in many instances, you may have a dentist in your area, but if they're not taking Medicaid or TennCare, then you still are having a challenge with access to care. And the most common reason is that it's typically the remuneration rate that dentists choose not to accept that.
Like medicine, dentistry services, oral health services in rural areas is a big concern. So do you have some thoughts about how the country might address that issue?
Some of the things that are currently in place, like loan repayment options, because it's no secret when medical and dental students come out of professional school, they have a large level of debt. And many of them also have debt from undergrad. And so when you want to give back, you want to serve all, and you're trying to also pay those loans back. So one of the things that has been done is having loan repayments for individuals specifically going into rural areas and rural communities. So more money can be put into those programs that will allow more people to choose that option that are willing to do that as well. Offering more federal scholarships for students for medical and for dental schools as well. There are resources there, but more resources can be put into both of those initiatives.
So what do you think that low-income and minorities can do to better support their oral health?
I think there's some basic things that we talk about that they can do at home. And so brushing regularly, there's a certain time period that the toothbrushes will last. And as we like to say, when you start out with a toothbrush, the bristles are standing up, they're standing straight, they're at attention, and they're working well. As they get tired, just like we lay down, the bristles lay down. When they start to lay down, they're tired and it's time to retire them and get another one. And so doing that on a regular basis, and on an average we say every 3 months, but seeing a dentist on a regular basis at a minimum of once a year. And so you don't have insurance, you can't afford it, but there are community health centers that have dental clinics, and those are usually done on a sliding scale, meaning that it's based upon your income. And what your income is determines how much you have to pay. So that may be that you pay nothing or you pay a minimal fee so that you can get those routine exams so that you can be proactive versus reactive, because the teeth are made to last a lifetime if we take care of them. And doing the regular brushing, that flossing, a lot of times patients or people don't floss, but that flossing, that little thin thread going between your teeth helps to get things from between your teeth that the toothbrush can't do. And it's amazing. You think, well, it's just a thin thread, but it can be powerful and amazing in doing that. So those are just some basic things. But then also being cognizant of what you're eating and drinking water versus drinking sugary sweetened beverages that can promote cavities, or eating healthy foods, eating fruits and vegetables. A lot of times people think that, well, I'm drinking orange juice or I'm giving my children orange juice and fruit juices, but they have a lot of sugar. So eating a lot of natural foods and doing more drinking of water and less drinking of juices that have a lot of sugar, and sodas and soft drinks as well.
Very good. So in medicine, we understand and know that early interventions when people are young can set them up for health for their whole lifetime. So is it the same thing true in dentistry, that if you intervene early in children, will that make a difference to their oral health as they grow older?
Yes, we kind of use the principle of what you teach children, those are habits that they will adopt as they become adolescents, as they become adults. And so those early practices of brushing your teeth regularly, drinking a lot of water, exercising, we do those things as a child and instill those things and make those things important. And teaching them the importance of, once you lose your baby teeth, when you get those grown-up teeth, those can last a lifetime, but we want you to take care of them. Just like we tell them, take care of their toys, take care of their clothes. That's another thing that they need to learn to take care of, and how to brush, and brushing for 2 minutes and making it fun, and removing that myth of you go to the dentist and the dentist is going to hurt you. You go to the dentist and the dentist is going to help you take care of your teeth. Whether you're low income or whether you have insurance, We always make certain that we take care of our children. And so having assistance through Medicaid to take care of our children, it provides for dental care. And while you have to be intentional about making certain that you seek out healthcare providers that will take your insurance or take your Medicaid to make certain that they are getting those regular visits, so that becomes just a normal practice and a normal routine. Because studies have shown that when children have regular medical and dental visits, that becomes a habit, and they continue those practices as they become older and as they become adults, because that is what was instilled as children for them.
We read about interventions like dental sealants and fluoridation of the tap water that we use in our homes, and they seem very important. Are there other interventions that you would recommend that we think about or consider?
In addition to drinking fluoridated water and using fluoride toothpaste, the evidence is there and shows that fluoride helps to significantly reduce cavities and fight against cavities. But also it goes back again to your diet and how you're eating and the types of foods that you're eating. I'm not saying that you have to just have a sugar-free diet and you can't have any sugar, but do it in moderation. For example, apples. Eating apples. Apples are not only healthy, but they help with massaging the gums and the gingiva and keeping those firm and healthy. Eating foods that are rich in fiber. Even drinking milk, but doing it in moderation, because milk, again, has a lot of sugar as well that can impact the teeth. So being very intentional, as we say, you can Google anything. So if you're not certain, Google it. One of the things that we say when we describe the grocery stores is that the things that are on the outside, on the outer walls, are the fruits and vegetables, the fresh meats. Those are the things that are typically on the outside. And so go to those areas first. When you start going in the aisles, that's where you see the processed foods and the foods that have a lot of salt and a lot of additives to it. So be intentional about staying on the outside walls as much as possible.
That's very interesting. Never thought about it that way. So one of the challenges I think that dentists have is that the people, when they think about going to the dentist, they associate that with pain. So can you tell us about some advances that people might want to know about related to what they experience when they come to the dentist's office for care?
Dentistry is really advanced in terms of being able to make it as comfortable as possible. A lot of times, of course, if you have to have a filling or you have to have an extraction, you may still have to have an injection. But you can be given nitrous to help you relax so that the experience can be as painless as possible. The needles that are used can be smaller so that, again, it feels like just a little light stick versus the excruciating pain. So the idea now is to make your dental experience as comfortable as possible. It's not unusual to go to a dental office and when you're sitting in the chair, it's a massaging chair that helps you relax while you're there, or to be able to look in the ceiling and watch TV, or to have headphones on to let you listen to music. So a lot of methods and approaches to help you relax are incorporated as well.
Very good. One of the things that we're thinking about now a great deal in terms of the higher education and healthcare and how we train healthcare professionals is the lack of diversity in the healthcare workforce. In medicine, we know that when the healthcare workforce reflects the population they care for, that the outcomes are better. Is that true for dentistry as well?
Absolutely. One of the things that we talk about is that minorities as African Americans, we make up about 13% of the U.S. population, but we only make up a little less than 4% of the dental workforce. And the same is true for dentistry as it is for medicine. When people are given the choice and they have the opportunity to be treated by people that look like them, the outcomes are better. There is a cultural sensitivity and cultural competency that we talk about when we talk about delivering care and understanding certain practices, certain beliefs as it relates to social determinants of health that you understand when you are from specific cultures. And so it is important to be very intentional about encouraging people of color particularly to go into dentistry as a profession and to see it as a viable option, because increasing diversity in the workforce, again, will also help with increasing the overall outcomes of oral health in those communities.
So, Dean Farmer-Dixon, you're dean of a School of Dentistry at Meharry that trains a huge disproportion of the nation's currently practicing African-American dentists. Something like 40% of them trained at Meharry. So, can you tell us about the overall picture of higher education in dentistry? How many schools are there, and why does one school train such a disproportionate share of the dentists?
There are a little over 70 dental schools in the country. There are 2 HBCU dental schools, Meharry and Howard. And the importance of that is that the number of dental schools has increased over the last several years. I say back in the late 80s, dental schools were closing. There was the feeling that the profession was saturated. Over the last 10 years or so, there has been a significant and intentional increase. Unfortunately, with increasing the number of dental schools, what we have not seen is a significant increase in the number of minorities that are being enrolled. So I think that Meharry has a significant role of training people of color and training people that are going to go into underserved areas and going to go into communities that have a significant need for access. And that is a part of what Meharry does. That is a part of what Meharry's focus. Meharry's focus is intentional about training individuals who are going to have a specific focus and a passion for serving underserved communities and for serving communities that have the greatest need.
So, on the medical side, the pipeline is an issue. We find that there are not enough African American Hispanic students who are entering the medical school because of their qualifications. So, is the pipeline also a problem when it comes to enrolling more minorities in schools of dentistry?
Absolutely. At one time, it was thought that you started when individuals were in college or in high school. But the reality of it, if you really want to make an impact, is starting with children when they start school and planting that seed then that you can be a doctor. And so we've done things like having medical Mondays at middle schools where we actually have placed a dental chair in a middle school and have the children, give them the opportunity to actually come in where we're sitting in the chair and letting them look in our mouth and pretend to be a dentist.
That's wonderful.
Or putting on elementary children, putting on white coats and letting them take pictures so they see themselves and they begin to imagine. That's what they do with basketball. They put a basketball uniform on them and they put a basketball in their hand. Why can't we do the same thing in medicine and dentistry, to put that stethoscope around their neck, to put that mouth mirror in their hand when they are in elementary school? And I do believe that there is power in numbers. And so by partnering with elementary, middle, high schools, and then with those families, working with the parents, because you can mentor all day and go into those schools, but if when they go home, their families are not going to the physician or the dentist on a regular basis, it's hard to encourage them, oh, this is a fun profession, when the family is not buying into that. And so it is a joint effort and a collaborative effort of working with other organizations that are in the community, that are doing things in the community, working with churches that are doing things in the community, so that it is a joint effort of us working with the schools, with the churches, with community organizations, with community health centers, to have the whole family educated and the whole family engaged in. But it is a long journey of partnering and making these pipeline programs really effective and impactful.
And so how did you yourself become interested in dentistry as a career?
It was when I was in high school, and I actually had the opportunity to go to a summer program, and I was introduced to different areas of healthcare. I shadowed in an OBGYN office and a family medicine, but it was when I shadowed in a community health center and I shadowed a dentist, and I saw the impact that he was making to see a lady come in edentulous and to leave out with teeth that made her look. I had guessed her age wrong by 20 years,
Oh, wow.
but it was a matter of how not having teeth made her look older, and just seeing the confidence right before my eyes when she got her teeth and how happy she was, or to see a man come in and has got to get an extraction and how apprehensive he was, but how the staff were able to calm him down and help him through that. And so it was in high school that I decided this is what I want to do. But it was that type of pipeline program that introduced me to dentistry and started me on my journey to doing that.
One of the things about Meharry is that it's tied deeply to the community around it. And can you just tell us about some of the ways that the dental school is working in the community to improve the health of the population?
One of the things that we realize is that not everyone can afford dental care and not everyone has insurance. And so we're very intentional. Twice a year, we have an oral health day where we provide free dental services. And it's not just exams, but we are doing fillings, we're doing cleanings, we're doing extractions. And we do that in the fall and in the spring. And each time we're seeing 400 to 500 people. And this is also an opportunity for our alumni to come back, for other area dentists to come and volunteer and give up their time, for social organizations and churches to partner with us. It really becomes a community event. And not only do we do that, but through our association with Fisk University and Tennessee State and some of the area churches, when they're having community events, we help support those to provide the services that the patients need. And these are individuals who unfortunately otherwise would not be able to receive dental services. And it also gives us an opportunity to educate them and to talk about ways that they can receive support and do preventive measures so that you're not just going to the dentist or seeking assistance when it is at the extreme nature, but how you can be proactive as well.
I want to give you a chance to close with a call to action. So what do you think the most important thing for our listeners to know or do to improve their oral health?
I think the most important thing is that they should know that the teeth can last a lifetime. It does not have to be a generational thing of, well, my parents lost their teeth, my grandparents lost their teeth, so that's what's supposed to happen to me. The teeth can last a lifetime. And there are things that you can do, like regular brushing every day, doing regular visits, but more importantly, being cognizant of what it is that you're putting in your mouth and staying away from those sugary, sweetened beverages, a lot of foods that have a lot of sugar, and eating healthy, but knowing what healthy means and seeking guidance. As I said, you can Google, so Googling, what are healthy foods that I can eat, and using that as a guide.
Well, I want to thank you for joining us today for this important conversation.
Thank you.
Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit www.mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.